This is another video from the series dedicated to the launch of our app this year. Very soon, launches very soon, but the video may be available earlier. The app is designed to connect chiropractor with patient, sports therapist, physiotherapist, who we also employ in the clinic, to the patient, or as we like to call you, the members of the practice. That's a new way of saying that you trust us to look after your health, being a member of the practice. So this video is about services we offer at the clinic. Most videos in this series, and the ones you will request from us and we'll make for you in the future, are free videos summarizing our expertise and knowledge collected from the best sources available at the moment in the world about health and whatever you need to know in terms of health and improvement and wellness. But this video is a promotional video. I said we're gonna have two promotional videos, one about clinic and the second one about the services we offer. So this one is about services. Of course, the first service we offer is the service of chiropractic assessment. It's not chiropractic treatment, it's not chiropractic maintenance, it's assessment. This is a very big thing, right? So someone will listen to you, your chiropractor will listen to you carefully for as long as needed when you tell them about your problems with your health, about your neck, back, arm, shoulder, whatever. We call it a consultation. Chiropractor will listen. They will not give you any answers straight away, but they will listen, record, summarize, and they will ask you lots of questions to get deeper insight in what's going on with your body, which made you suffer and which made you come to us for help. Then we offer an assessment, and it's not just a chiropractic assessment, it's a chiropractic, neurologic, orthopedic. Orthopedic is to do with joints, with movement, flexibility, alignment, function of your shoulders, arms, knees and feet, and we got hundreds of tests we can implement, we can do. Most of them are painless, of course, to test the function, orthopedic function of these joints and the spine, of course. The neurologic exam normally involves the sensitivity testing, which tests your nerve endings, how the parts of the skin connected to your brain through the spine, and the testing of the reflexes, the jumpy beats, I call it jumpy beats, yeah, to test the main function of the nerve. They can also include, the neurologic testing can also include other specific tests like cranial nerves, the nerves in your neck which goes to your face, very important. Other specific tests for certain damages to the nervous system. And we like to look at your imaging. We also like to look at your x-rays. The x-rays are very strictly regulated in UK, so we cannot promise we will take x-ray of every person, because there is a very strict criteria, strict rules for taking x-rays in UK, and that's where we are in UK. So we like to see the image. The images, which if we take them standing. It's very important, because standing on straight legs, barefoot on the floor, gives a very good understanding of your alignment, of your pelvic alignment, of your low back, upper back, neck alignment. Again, if we can justify taking the x-rays, looking at your examination findings. So the x-rays show the alignment, and they show the wear and tear, how much the joints may be worn out of alignment, worn away, discs spaces, reduced changes in the bone density, and other many little things we learn when we study chiropractic and study medical X-ray imaging in general. If you do have an MRI, even better. MRI shows more soft tissue, more disc, more other structures around the spine, which are very important to see. So we look at the MRI and we know how to read the MRI. That's one of the things chiropractors taught in the university when they study their course of chiropractic is imaging. So we got consultation, examination with up to 60 different tests. We test your blood pressure as well, your oxygen levels with a simple oximetry test. We can listen to your heart if needed using a normal stethoscope. Consultation, examination, X-rays if justified and needed, as well as assessment of your current imaging you may bring with you, old X-rays, previous years X-rays on MRIs. If you have any reports from your DEXA scans, bone density scans, or your ultrasound scans, bring them in with you, we'll assess them. So that is the service of chiropractic assessment. That gives us a lot of information about you, and nothing, no thing in this assessment is little. All of them have very high value, because missing one little thing may totally change the picture. So be patient with us. We may need more time, we may ask you more questions, we may dig in, and all of this of course going to stay in the room. All of this is confidential. It will not go anywhere at any request except your own request, so that you can be safe on that. That is chiropractic assessment. Very important service. We take it separate from anything else, and it comes with another part of this service, which is a report of findings. So normally the first appointment takes half an hour or more if needed. The second appointment, the report of findings, is also half an hour, and that is when we come back to you with the analysis of all the data we collected on the first visit, your consultation, examination, X-rays or MRIs or whatever we have as a physical basis of our diagnosis, and we analyze it and discuss it with you. The report of findings, the chiropractor will quickly go through the findings on the first visit, will and supposed to tell you, not only in our clinic, everywhere, why they think, the chiropractor thinks you are in this particular condition of suffering right now, how these problems occur in the spine in general, which actually covered in my other videos, but it may be very specific to you, to your occupation, to your history, to your condition, whatever it may be. They will answer your questions on that. They will answer all your questions. Just make sure you have the questions ready, right? So they will give it back to you, what they found at the first visit. They will show you your X-rays, or if it was an MRI, they will have snippets of your MRI to show you, to say, look, this is what is causing the problem right there. Okay? And then of course the chiropractor, having their experience through many cases like yours, they will tell you what needs to be done. It may be chiropractic adjustment, it may be massage, it may be changing your activities, posture, alignment, flexibility, diet, weight loss. They will cover it all. If it's not enough time, they will cover the basics, and the rest will come later when you return to the clinic for further treatment information, advice, etc. Our abilities are not limited. We work for the patient. So talk to your chiropractor, ask them what you want, tell them what you expect, and they will deliver it to you. So this is our main service: chiropractic assessment with consultation, examination, imaging, or imaging interpretation along with the report of findings you receive on the second visit. Report of findings is free. If you do have a treatment, later, after report of findings, if you have a course of treatment, if like many patients you have a course of treatment and you also stay for maintenance, fine, thank you very much. We will enjoy our cooperation and mutual success. As our success as managers of your health, thanks for your trust, and you will enjoy good health thanks to our management. That is if we agree on the diagnosis, on the problem, on the management, great. If you receive your report of findings and you need to think, you go and think. There's no problem, right? If you need to take time before you start your treatment, you take your time. If you decide not to have treatment but try your own way of management the condition, now when you know so much about the condition and how to fix it, you go your own way. And we only wish you good luck and remain your advisors and your help if needed. That's fine. So that is our service. Number one. Service number two, of course, is the adjustments, right? We normally give patients a plan of management which includes a number of treatment across time, a certain time, because body needs time to repair. You will be given an adjustments plan, a treatment plan you need for the time which normally shows to be effective in cases like yours. And if you follow the plan, you tend to improve. But we do check you on the way. Every month or every stage of care, we do an exam, we ask you all the questions again. We do some tests to test you against your previous test to see if you're improving, and if you're improving fast enough, and if you don't improve fast enough, we try to look for the answer why. We do it together with you, so we can help you more. That is our main service after the assessment and the report of findings, is the adjustments themselves, of course. I will give you more about chiropractic adjustment in my other videos about chiropractic adjustment. And here I need to continue about other services. Of course, as it is said in other video, we have a massage service. The massage advised to a patient at certain stage of care when it is safe and reaps the most benefits. But generally massages are amazing. It's a passive exercise which improves circulation, flexibility and tone and many things. So that's a very important service we offer at the clinic, massage. So ask your chiropractor when, at what point you need the massage, so you get it at the right time for the best benefits. If you're not a chiropractic patient and you don't receive treatments, the sports therapists who deliver massage are highly qualified with a lot of experience in this field, so they will tell you whether you need massage or not, how much of it and how often and what type. They will tune it to you, to your needs. So you're welcome to come just for massages to the clinic if you are not a chiropractic patient. It's open for you. Now, other services of the clinic are geared and tuned to your general health, because improving your general health, you improve your recovery from back pain, neck pain, shoulder pain, leg pain and all other little things we are dealing with every day in the clinic. So we do offer a certain type of vitamins for our patients. Our vitamins we choose very carefully. Unlike most of high street brands, we try to choose vitamins which are powerful, which have active ingredient of the highest standard and quality in a large amount, which is safe. Obviously, manufacturer of the vitamins researched it and it is safe to be taken at certain amounts which prescribed by the manufacturer, right? And the most important vitamins we do provide at the clinic. If we don't have them, we will tell you what to get. We'll give you a link where to buy it, Amazon or Holland Barrett's, and we tell you what not to buy, because a lot of things just useless, really. They are useless, right? So ask your chiropractor about vitamins or other nutrients like collagen. We offer very good collagen. It's bovine, it's grass-fed, it has additional things added, extra glycine, vitamin C. I was waiting for this product for many years, so finally it's there. It's there now, so you can get it. So vitamins, nutrients we provide. Other things which again help with faster and better improvement of the patient. We offer insoles for your feet. If you have flat feet or overpronated feet, or if you're not sure, ask your chiropractor. The chiropractor will tell you anyway after assessment. So don't ask them, just they will tell you anyway. Insoles. If you want to make your shoes less harmful to your feet, which will also help your knees and hips and posture. Again, and that will be covered in another X-ray, in another video, sorry. Insoles are there for you. They will be tailored and chosen by a chiropractor for your particular foot, for your problem, for your needs, and they will serve you well. And we'll be responsible for these insoles because we had this brand of insoles for a long time. We know how they work. We're kind of responsible for what we offer. So we have all the services available to you if they need it. We also have vitamin D tests available now because a lot of patients need vitamin D. They're deficient in this country because there's lack of sunshine and we sit in a building all day, most of us. And when we're outdoors, there's no sun and we're all dressed, so we don't get this D produced in the body. So if you want D or D tested, because you just can't be asked to go to GP and beg for it. Well, some people are lucky, they have great GP and they test their D immediately and they get results and they have the copy of the result and we help them to interpret the result, and we have some printouts of the evidence of what your vitamin D should be, so you can compare with that. If you don't want to go through that, just grab the test. I think it's £30 or something, and just do a finger prick test, send it off, get the result, and we go from there. As covered in other videos about food, about diet, again, videos in the same series dedicated to the launch of the app and your general health and allowing you to connect to us better. We have food sensitivity testing. All these little things which help your body to fight inflammation in your spine and joints. Food sensitivity. DNA testing. Again, for the same reasons, to improve your repair and to decrease inflammation in the body. Food sensitivity, DNA testing, and microbiome. They are not cheap tests, but they are very important tests. We recently launched that actually this year, beginning of this year, and the more we do the testing, the more we deliver the results to the patient, and the more we see patients following the advice given following these results, the more we see the results improvement, the more we see patients' conditions improve, their general health improve, their happiness improved. So that's a great service. If you want to ask your chiropractor when you're in the clinic about food sensitivity, or if you just see this video and you want to pop in and do the testing, because it's a high quality professional company who does the tests, we will get the results. So you have to agree for results to be shared with us, and we will help you to understand and interpret the results and we will answer all the questions to do with results and provide information like leaflets to explain how it works, for example, the food sensitivity. But again, this video is about services, so that's another service to help you to improve from your spinal condition, joint inflammation conditions, in line with consultation, report of findings, chiropractic treatment, massage, correct vitamins which are effective for you in your particular case, testing for vitamin D, and I think more vitamin tests are coming soon as well. We're just waiting for them to be developed for us. This particular service, the new service, the food sensitivity testing, the DNA testing, and the microbiome testing is available now. So don't hesitate to ask, discuss it with us, and we'll try to oblige and help in every way we can. And don't forget to download the app when it's available. See you soon, and waiting for your questions. Bye bye.